Now, to help us celebrate our 2 decades of hard work and as well as amazing partnership we have with the National Association of Community Health Centers, I would like to introduce and call forward Dr. Ron Yee, NACHC Chief Medical Director. Dr. Yee has a long and distinguished history of dedication to the community health center movement at the state and national levels. Before joining NACHC, he was the Chief Medical Officer for United Health Centers in San Joaquin Valley, where he worked for 2 decades. He received his medical degree from Oral Roberts University School of Medicine, completed his family practice residency and chief residency position through UCSF School of Medicine. He also holds an MBA from Golden Gate University. He's been on the National Health Service Corps National Advisory Council, and he's also served as an associate clinical professor at the UCSF School of Medicine. We are so privileged and honored to have Dr. Yee not only with us today, but with his incredible position at our National Association. Please join me in welcoming him.
Thank you, Carmela. And I was talking to some of you earlier. Feels like coming home. As she mentioned, I practiced 20 years at United Health Centers in the Central Valley Health Network as a family physician, and just loved every moment of the practice, but felt the challenge and kind of a calling to move forward and to go national so that we can have a bigger impact for our patients here in California. So thank you so much, and I am honored to be here on behalf of NACHC at this great celebration. Joe Gallegos, who is our Western Vice President, Senior Vice President of Western Operations, could not be here because of family commitments, but he wanted me to send his congratulations and thanks for all that you have done, Carmela and her staff and the CPCA over the years. I did want to take one moment to recognize someone. This is a person who actually was on the charter original board of directors of CPCA 20 years ago, and actually the same gentleman who hired me. So my job at United Health Centers was my first and only job for 20 years. NACHC is my second job. But I wanted to recognize someone who has dedicated his life to the health center movement as a CEO, and now, since he's retired, as a board member. So he has not finished his work yet, but over in Hollister, he's on the board of directors. I'd like to recognize Mr. Arcadio Viveros. Arcadio. Whenever I see Arcadio, I always thank him for giving me my job, because I wouldn't be here today if it not for him. So thank you so much, Arcadio. Joe shared some ideas with me as I present this award to you, Carmela, and to the CPCA, just as he reflected over the work that's been done over the last decade with Joe specifically when he came to NACHC in 2005. And what began as an effort to improve communication and relationship between CPCA and NACHC has really turned into and evolved into a true partnership where there's give and take and there's a lot of collaboration in the work that we all do. You know, as Carmela mentioned, there are so many things going on with CPCA. You are on the leading edge of a lot of the work across the nation. I get to see a lot of things that go on, and NACHC always looks at California and CPCA as kind of like the laboratory or incubator for the rest of the nation. The first ones to do a lot of things. California is very unique, also representing 12% of the total population of the United States in California. But within California, we have a very unique mix of the population, diversity. We have homeless population, HIV/AIDS. We have migrant seasonal farm workers. We have all kinds of different populations here. We have the rural-urban combination as well. And so California in many ways serves as a microcosm for the nation of what is going on in healthcare. And so what happens here in California becomes viewed as a place for setting the stage of trends or other things for states to follow. So California is actually on the leading edge of this work. And NACHC looks to California and CPCA as a reflection of really what's needed across the nation and where we are going. So we thank you for that. I think good examples that Carmela just mentioned is your work on alternative payment methodology, on the CP3, and really focusing on value-based care. And that's really where we're going as a nation, and you guys are leading the way, so thank you so much for that. Joe mentioned a few things that I wanted to note on some of the work that we've collaborated together with over the years. CPC and NAC partnered in a civic engagement and advocacy initiative a few years ago to really grow the advocates both in California for your state issues and also nationally. And this initiative provided advocacy training to health center boards, staff of the regional consortia. We worked on voter registration drives and also community events during National Health Center Week. And from that, the health center advocates grew exponentially in both California and for national support. So we thank you for that. A second thing that Joe noticed was another initiative looking at membership, and I think CPC and NAC kind of teamed up to develop a unified voice, working together at the state and federal levels in the implementation of the ACA, and you mentioned a lot of the accomplishments, so we thank you for that. This really required a lot of close coordination and collaboration with federal agencies, including CMS and HRSA and the Bureau, to really shape and form these policies, so thank you for that as well. And finally, what is noted is the whole communication piece that I think has been excellent. Carmela, her staff, and the executive team have always welcomed the NAC staff to come and give reports to committees. Yesterday, I had this opportunity to spend some time with the Clinicians Committee. Always make a point and welcome the NAC staff to have those communications we need to move a lot of issues that are state-based forward on a national level. So we thank you for that. And likewise, when you're all out in Washington, D.C. at the P&I, Carmela and her staff always make time to meet with our president and CEO, Tom Van Coverden. Tom is so thankful for that because it helps him to keep in contact with what's going on in the front lines and for us to talk to our policy staff to really bring those issues forward. So thank you for that as well. Another note was Joe mentioned was just the hospitality he feels whenever he comes here. He tries to get to California often, being on the western regional side, and he notes that this hospitality is just a testament to Carmela's strong commitment and the stellar leadership that she exhibits and she finds and has in her staff. Building this partnership could not be possible without the hard work and commitment of CPC and NAC. So looking back over the last 20 years, CPC has grown in size and in scope, really changing dramatically to meet the needs of the membership and also the patients here in California. So there's been a lot of change, but one thing has not changed over the last 20 years, and that's really something that's remained constant, and that has been the underlying belief in strong service and impact to the communities we serve here in California. I think that's really been the hallmark of CPCA's history, is that focus. So in closing, I wanted to call on you and challenge you as we celebrate the 20th anniversary of CPCA to make this special occasion a reaffirmation, a recommitment, and a rededication to continue the work that we're doing together for the dream that gave birth to CPCA 20 years ago and today lives and gives it life. So let's focus on that. Let's keep moving forward to the day when all the people of California, and indeed for all Americans, access to quality care is the standard and not just something for the privileged. So thank you so much for all the work that you do. Thank you, CPC and Carmela, for the work that you have done. And I'd like to present an award to you on behalf of NAC. So this is presented to the 20-year anniversary award, the California Primary Care Association, for your excellence and dedication in support of California community health centers, community clinics, and networks. So congratulations, Carmela, and thank you so much from NAC. So thank you so much.
We're so fortunate to have a tremendous partnership with NAC. Our relationship truly has evolved over the years into such a strong, lasting partnership, and we certainly value and appreciate everything that NAC does for our health centers. So thank you so much.